Hi, I'm Libby.
And I'm Marion.
And we're from Cooee, Speech Pathology and Occupational Therapy.
We're here today to talk about our therapy process. And we're going to start off by talking about our client journey planning sessions and what they are, what you can expect when you come to a client journey planning session at Cooee.
At Cooee, we take a structured approach to our intake, our assessments, and also our therapy cycles phases.
We know that every family that we work with and all of the kids that we meet are really unique and really individual. And so this process allows us to customize and tailor the process just for you. And so the client journey planning session is our intake session. It's the first session where you meet with either a speech pathologist or an occupational therapist and basically get the journey started.
And this may not be the speech pathologist or occupational therapist that sees you for your individual therapy or assessment phase, but this is our almost like a setup session. What we are aiming to do is to welcome you into Cooee, explain our processes, but also to find out detailed background information about your child or the client in order to determine and understand the next steps in the therapy process.
So what you can expect is the therapist will, first of all, introduce themselves and listen to your concerns. We want to know why you're coming and to gather some background information, as Libby said. So there's going to be lots of questions that we ask, and you can also bring along any reports or documents that you have from other professionals that you've worked with. And based on the information that you provide, the therapist is then going to give their recommendations for the assessment phase that's required, and also give you some education about that area of development so that you understand a little bit more walking away from this appointment what might be involved in the process long term.
And this part of our therapy cycles, the clinical journey planning session, we really ask that it's more just between the primary caregivers and the clinician doing the session. The reason for this is so information can be shared freely and without any little ears listening in.
It's also helpful to not have any distractions in these sessions as well, while you're talking about some really important goals and aspirations that you have for your child and receiving some information that can be complex at times. So the client journey planning session can go for up to an hour. It doesn't always have to. It's based on what's required by the family. And these sessions can happen in person here in the clinic or via our secure telehealth platform, up to you and what you need. You can book these online via our website or also just by calling the clinic. So let's talk about the assessment phase here at Cooee. And this phase is structured in the same way, regardless of whether it's speech pathology or occupational therapy that you're accessing. So Libby, what happens in the assessment phase?
So from our clinical journey planning session, an assessment is recommended whether it needs to be a comprehensive assessment where we look through our assessment protocols and determine what is the best assessment to gather baseline data for the client or child, or if it needs to be a bit shorter and sweeter, say if you've brought other reports in and the therapist has looked over them. But we still always start with a level of baselining so we can gather data in order to measure our outcomes throughout the therapy process.
That's right. So our assessment protocols are based on the current available evidence and best practice for assessing different areas of development. And so what your therapist will have done in their client journey planning is recommended the assessment process that's right for you and then tailored it in any way that they might need to based on your unique information or the therapies you've accessed before.
And this might mean breaking an assessment session into a number of different appointments in order to make the client feel comfortable and to gather the best possible information that we can get. This information is then all collated, synthesized and integrated by the therapist, and you receive a report as well as a feedback session, which can either be face-to-face or via telehealth, to talk about the information and then determine the next steps of the cycles of therapy.
So assessment can look like a variety of different things. Sometimes when a therapist is assessing a child, that might be face-to-face with the child in the therapy room. But assessment can also look like other things. It can look like interviews with the parents, with other people that are involved in your child's life, maybe at daycare or at school. Sometimes there's structured questionnaires for parents, carers, or other people that are involved. And sometimes assessment might be just looking, it might look like it's just playing, or watching parents and carers play with their children as well.
And sometimes it can involve all of these aspects in an assessment protocol. And it's important to note that these are based on the current level of evidence that we have in order to gather the best possible information we can.
We want to make sure that we're not just having a look at what a child might be able to do here in the clinic, but gathering comprehensive information about how the child participates in different areas of their life out in the community as well. So it's a really comprehensive assessment and an accurate picture of that area of their development.
Rounding out our assessment phase in the cycles of therapy is an opportunity with our feedback session to start setting some really meaningful and functional goals. And to do this, once again, we do recommend a session where it is the caregiver and clinician providing the information about what the assessment found, and to also determine those goals moving on to a therapy cycle. And those therapy cycles can, once again, look different for every family and every child that comes through our Cooee doors.
That's right. So therapy can occur in lots of different ways, and we want to wait until the assessment data gathering phase is complete before we make a recommendation around what type of therapy might be right for the goals that you're wanting to work on. Sometimes that's therapy in the clinic, sometimes it might be a different service with therapy outside the clinic, sometimes it might be joint sessions, sometimes it might be consultative programming. There's lots of different options that are available, and it really depends on what we find at the end of that assessment phase and the meaningful goals that the family want to work on. So this is why we structure these phases in such particular ways, is because we want to be able to make the right recommendation at the right point in time with the family involved. So at the start of the therapy cycle, the goals are clear, and also the plan for what's going to happen and how therapy is going to be delivered in partnership with the family throughout that 3-month period. At the end of the 3 months, we stop, pause and check. Has it made the difference that we were expecting that intervention to make? And if not, what are we changing as we move forward? And that process of calibrating with families reoccurs every 3 months as we continue through their therapy journey. So we believe this process of structuring the cycles of therapy from client journey planning session to assessment and to cycles of therapy is an ethical process, and it helps us deliver best care for children, which means that families are getting the outcome, which is the reason they're coming to therapy in the first place. We also know that sometimes the cycles of therapy and the process of achieving goals can take a while. It can go through multiple cycles and sometimes years as well. So that's why we call it the therapy journey. That's why we call it a clinical journey planning session right at the beginning, is because we understand that therapy is a journey and we're here to walk it with families.